In Wu in stock cage study and nano help us struggle illnesses of cardiac illness to superbugs, is the melting of biological and technique acceleration us to a science fi next, portion humane, portion artificial? In Ridley Scott's fruitful blockbuster movie Razor Begun, Humanus has harnessed biography engineering to build a racing of replicants how see, act and audio humane, but are done completely of artificial content. We may be far of implementing how science fi next, but synthetic are start to include a deep impact on medical. At their country of the art laboratories in Post Kong, scientists of Canada business Novo Heart are with stock cells to build biography artificial hearts the business telephone call hearts in a pot. Of fair of yours bloodstream, Professor Ronald Lee and his crew are capable to build stock cells how can later be rotated in a mini cloning release of yours cardiac how beats love your and reacts to new drugs the way your would. The trial conducted 6 months. Professor Lee believes the technology could rate up the stream of urgent new medication since capacity party effects could be spotty up achieving the costly humane test phase. Narcotic growth is a long, costly, and ineffective trial, characteristically standing $2, $3 bn and take more than rather than 10 years to evolve a solitary narcotic, in inadmissibly top fail rates of 90% or worst, he says. This considerable industry hazard has leading in exhaustion of the pipe of new drugs by pilot growth. Stock cage derived, biography artificial cloned security organs constructed of the patient's own bloodstream could ultimately be the next of replant medical, says Professor Lee. Stock cage derived tissues and security organs are not fair scientific fictitious any more than as creation hearts in a pot. Biotechnological companies are as well print residing fabric with special 3D printers. The fabric can be utilized to make leather for grafts, or gristle for joints, for sample. Methods of bioprinting vary but the main concept involves with gene content, or biography inks, the way a regular printing device uses common toner, on in a scaffold content to exceed the gene content along to shape particular shapes. One bioprinting expert, Dimension Biosystems, newly shaped a association in Johnson & Johnson to evolve 3D printed knee joint meniscus fabric, the slim, fiber gristle among several of yours joints. In the following 10 to 15 year, I trust we will see the at first really cage containing bioprinted 3D tissues how are adopted for use as implant fabric therapy, says Handler Mohammed, head execution at Dimension Biosystems. As gristle and security organs, the artificial additions to our bodies could one day involve nanobots, diminutive programmed biography machines patrol our bloodstream streams looking for carcinoma cells and bacteria to murder, fair as our white's bloodstream cells do. Arizona Country College, Air Separation Unit, scientists, in cooperation in researchers of the Domestic Center for Nanotechnology and Technique at the China Academia of Sciences newly programs nanobots to decrease tumors by cut off their bloodstream delivery. In comparison with car microrobots done of mechanic components, these nanobots were intended with DNA origami, a method comprising DNA creature stacked in shapes. Every one was done of a plain, square DNA origami leaf, 90 nanometers by 60 nanometers, a nanometer is a billionth of a meter, and a bloodstream clotting ferment, named thrombin, was assigned to their shallow. In the at first such a testing on mammals of its type, the crew injected carcinoma cells in a mouse pointer to build a tumor, later injected the nanobots. They begun work during several hours, block the tumor's bloodstream delivery and declining it following a couple-week year of treat. Hao Yan, CEO of the ASU Biodesign Institution's Center for Molecule Style and Biomimetics, says the following move will be to execute a humane test, that should be in the following 3 to 5 years. The outcome represents just the start stages of nanotechnology medicine, he says, or we are especially agitated since the technique is a policy how can be utilized for lot types of carcinoma, with all continuous tumor-feeding bloodstream where are substantially the identical. Synthetic are as well creature marshaled in the struggle versus antibacterial impedance, while antibiotics be inefficient versus new strains of superbug. These superbugs murder about 700,000 human beings a year world, says the UK Overview on Antibacterial Impedance. By 2050, 10 millionth human beings could die every year if current antibiotics go on to miss their efficiency, the paper suggests. Move Stryker, Ninja Polymer Production, Artificial Bacteria Killers. Scientists at IBM study Almaden in California, work in Singapore's Institution of Biological Engineering and Nano of the Agent for Scientific, include advanced artificial molecular resin intended to murder 5 fatal types of multi-drug-resistant bacteria. The resin plant by mandatory himself to the communicable content, manufacturing its way within the external diaphragm, later lathe the fluid within the bacteria in continuous content. Critically, the happens so quick how the bacteria don't include period to play back and undergo on any impedance. The crew proven the polymer production on mice contaminated in 5 difficult to treat much drug persistent bacteria. The results showed how the bacteria were ruined. One of the men guideline the study, Dr. James Hedrick, says the crew is as well evolving the technology for use in carcinoma treatment, with hope far less party effects. In every instance, the therapy are very selectivity to their goal out of findable party reactions, he says. Besides, every of these macromolecular therapies are intended to rot in harmless on products how are readily scent of the flesh. Dr. Bertalan Mesko, CEO of the Care Futurologist Institution, says medical has been cladding over in the technique stakes for far too length. Time lot industries step in the 21SAINT age, health hasn't. Millions of patients are on transplant wait inclusive, clinic testing how put new drugs on the marketplace occasionally get a 10 years and price billions of dollar. These woo in synthetic pledge the targeting and personalization of treatments to an person's gene and molecule backdrop, says Dr. Mesko. Companies evolving digital public health technologies not just give health to the 21SAINT age but as well do patients the spot of care.